If you were growing up in Detroit in the 1970s or 80s, chances are you knew the city's health department, the Herman Kiefer Public Health Complex, by both sight and reputation. Opened at the turn of the century and later enhanced by renowned industrial architect Albert Kahn, the imposing health facility was named after a local infectious disease doctor. As the city grew, so did the brick complex and the services offered within, becoming synonymous with public health in the eyes of many families and residents. For decades, this was the trusted place you sought out to pick up birth records, get tested for tuberculosis, get vaccines or undergo discreet diagnosis and services for sexually transmitted diseases. It was a place some parents told their children to go to if they needed help, the way other parents tell their kids to go to the police if they're in trouble. That was before the lean years that led into the Great Recession of 2008. By the time the complex was abandoned more or less overnight in 2013, it had fallen into vermin-infested disrepair and housed only a fraction of the dedicated employees who once walked its halls. City officials gave up on the building, and dismantled the public health department it had come to represent. Eventually, the city sold the Herman Kiefer complex to an out-of-town developer, who marketed it as a commercial property. All across the nation, public health departments have seen dramatic cuts over the past decade in a trend that has hit communities big and small, rich and poor. When state and local government revenues falter, health departments run by cities, counties and states are often the first to lose funding. When politicians shutter a school or close a subway stop, the impacts are immediate and visible, sparking sharp public blowback. But when a health department fires its contact tracers or closes its infectious diseases lab or stops testing children for lead exposure, the impact is more subtle. Across the decades, Detroit has often experienced a magnified version of the nation's economic and health woes, and the same holds true of its experiment to streamline and privatize public health services. A health department that had 700 employees in 2008 had just 5 by the end of 2012. Though it has slowly been rebuilding since 2014, it now employs approximately 270 people. Damage done during the leanest years has been on stark display amid the ravages of the COVID-19 pandemic, offering a cautionary tale to America at large. Vernice Davis Anthony loves thinking back on the good years. In the 1970s, she was one of dozens of public health nurses working for the Detroit Health Department. Originally from Pennsylvania, Anthony moved to Detroit to attend nursing school at Wayne State University where, as a young black woman, she'd heard she could get a fair shot at an education and career in the majority black city.